What's up?
The first value that we are looking at is blood hemoglobin level. 81 hemoglobin is lower than normal. Decrease in hemoglobin concentration we call anemia, and once we see anemia, we have to determine how severe is the anemia and which type of anemia it's according to the size of red blood cells. So how severe is the anemia? In order to tell this, we have to know two numbers. It's 110 and 80. So normal hemoglobin level for male is 130 to 160, for female 120 to 140. From 110 to lower limit of normal is mild anemia. From 80 to 110 is moderate anemia, and lower than 80 is severe anemia. So in this case, hemoglobin value is 81, so it's moderate anemia. The type of anemia, according to the size of red blood cells, we determine by MCV. The red blood cells with MCV between 80 and 100 called normocytes, greater than 100 macrocytes, and lesser than 80 microcytes. In this case, MCV is 96, so it's normocytes. So it's moderate normocytic anemia. Usually, when hemoglobin is low, red blood cells are low. And in this case, red blood cells 2.43 is significantly lower than normal. The next value is platelets. Platelets are 15, which is significantly lower than normal. So now we have to say how severe is the thrombocytopenia. With thrombocytes we have to know two values, it's 100 and 50. The normal value of platelets is 150 to 400. From 150 to 100 it's mild thrombocytopenia, from 100 to 50 moderate, and lower than 50 is severe. So in this case it's severe thrombocytopenia. The next values that we are looking at are white blood cells. As we see, white blood cell count is 56, which is very high. So now we have to determine due to which cells we have so elevated white blood cell count. And there are three major possibilities. White blood cells consist of three major groups of cells. It's myelocytes, lymphocytes, and blast cells. Myelocytes consist of monocytes, basophils, eosinophils, and neutrophils. The first cells that we are looking at are blast cells, because in normal state there are no blast cells in peripheral blood. And in this case, blast cells consist 54% of all white blood cells in peripheral blood, which is huge. And the condition with such huge amount of blast cells in peripheral blood we call acute leukemia. To confirm the diagnosis, we should take bone marrow aspiration, and if on bone marrow aspiration the amount of blood cells is greater than 20 from all cells inside the bone marrow, it's acute leukemia for sure. The problem is that under the microscope it's impossible to say blast cells are myeloblasts or lymphoblasts, because all blast cells look practically the same. It's large cells with huge nucleus. So in order to tell it's acute myeloid leukemia or acute lymphoblastic leukemia, we have to stain them. And in order to do this, we use cytochemical markers which are specific to a certain type of cell.
What?
One of them is TDT. TDT is a signature feature of lymphoblast. TDT is DNA polymerase, and the key feature is that TDT is present only in the nucleus of the lymphoblast. So once TDT is positive, we can say that it's lymphoblast. Also we have PAS reaction, which stands for periodic acid shift stain. And this reaction basically determines the amount of glycoproteins in the cytoplasm. And the concept is that lymphoblasts have huge amount of glycoproteins in the cytoplasm. So positive PAS reaction equals to lymphoblasts. Another marker is myeloperoxidase, and even from the name we can say that this marker is specific for myeloblasts. So by cytochemical reactions we can tell it's acute myeloid leukemia or acute lymphoblastic leukemia, which makes a huge difference in treatment. Also, as we see, the percentage of lymphocytes is lower than normal, and the percentage of myeloid cells decrease, especially segmented neutrophils. This decrease in normal cells occurs because blast cells basically invade the bone marrow, and they crowd out normal cells from the bone marrow thereby disrupting the production of normal cells.
Okay. Fine. Yep. Ciao.
What's that mean?
Ciao. It's Italian. Means food.